Good afternoon, good evening. My name is Omar Lattouf. I am the founding president of the International Federation of Healthcare Thought Leaders, Professor Emeritus, Emory University, and Professor of Cardiovascular Surgery at Mount Sinai Icahn School of Medicine in New York City. My guest today is a dear friend and distinguished physician, Dr. Fawzi Al-Hammouri from Amman, Jordan. Dr. Al-Hammouri is, by practice, is a pediatric endocrinologist trained in the UK and currently holds and has held the position of Chief Executive Officer and General Manager of the Specialty Hospital in Amman. He is the president of the Jordan Private Hospital Association and has served as president of the Global Healthcare Travel Group and currently holds an honorary presidency position in the same group. Dr. Al-Hammouri has distinguished himself as being a visionary who pushes the envelope beyond the limits and accomplishes objectives that are that would seem impossible when one looks at it. I'm very pleased to have this opportunity to have a chat with Dr. Al-Hammouri and speak about a number of projects. We're going to speak about his hospital and where it was and where it is. We're going to speak about graduate medical and surgical education and how he brought it to a different level. Speak about the Private Hospital Association and the Global Health Travel Group. And then, if time allows, we will ask him some questions about the status of the coronavirus in Jordan and the surrounding area and how that has been managed. Dr. Al-Hammouri, welcome. We're glad that you're with us. Thank you for taking the time at 8 p.m. Amman time, and we look forward to hear from you and then speak with you and ask questions. Please share with us some thoughts.
Well, thank you, Omar, for organizing this meeting, and we all in Jordan looking forward to see you in Amman. And I would like to thank you also for establishing the International Federation of Healthcare Thought Leaders, which bring together experts from around the globe. And also I would like to welcome all friends and colleagues who joined us in this meeting. So you asked me about my hospital, the specialty hospital. I remember when I joined and took the chairmanship of this hospital, you were in Jordan. And you remember that it was like a small, ordinary hospital with a few capabilities and limited number of employees. So we thought what we can do to make a big difference. And we had to think in a smart way to change the path of that hospital. So the first thing that we did is to establish a good team with a spirit to make a big difference. So we started to build trust of physicians, trust of patients, and the trust of employees. So we defined our strategic goals. So we had 6 strategic goals. I will talk about them briefly. The first goal was to improve the quality and patient safety. And this was the cornerstone, I believe, that made a difference in the specialty hospital. And we started in 1999 by getting the ISO certificate. So it was ISO 9001, which ensured the consistency of work and developing the procedures and policies that help to improve our performance. And we proceeded with other certificates until 2005, where we were very proud to achieve the King Abdullah Award for Excellence. and this is considered the highest level of quality and excellence recognition in Jordan. And the hospital was the only hospital to achieve that certificate, and actually we got it twice. And then we went into accreditation. So we were the first hospital to get the Healthcare Accreditation Council in 2008. And then we got the JCI accreditation. And you are very familiar with that because it's an American organization. And we had the general accreditation, but we went further to get disease specific for cardiac accreditation. So we were the first hospital in the region to be accredited from GCI for cardiac disease. And we were number 7 in the world to have this accreditation. And we thought because cardiac disease is one of the main causes of death in the Middle East, we established Cardiac Center of Excellence. So we have the Cardiac Rehabilitation Center, and we have 3 state-of-art cath labs, and we buy the CT 512 CT scanner, which can do the CT coronary in one heartbeat. And also we expanded our CCU ICU unit, so now we have 30 ICU CCU beds, which is the largest in the private sector. In 2017, we have been recognized by the Joint Commission International as a Center of Excellence for Cardiac Diseases. So this was the first strategic goal. Our second strategic goal was to attract talented staff. You know that the staffing and the employees are the cornerstone of any organization success. So we had strict criteria to select qualified, well-educated people, proper orientation and training, and continuous education and monitoring and evaluation. And also we gave them confidence and we gave them trust and we let them feel that they are part of the specialty hospital family. And after that, we had to have a safe environment for them in the hospital. So we got the OHSAS 18001, which is a certificate of the safety of environment, work environment in the hospital. At the same time, we have to give them good salaries, good incentives, and also health insurance, and social security, so they can feel comfortable and secure. Our third strategic goal was to improve the hospital infrastructure. You remember how the hospital was? So we had to build the new wings, new units, new departments. We expanded our operation theaters. Now we have 21 operation theaters, which is the largest theaters in the private sector. Also, we had a helipad for air ambulance, which is a new service, has been implemented in Jordan for the last few years. And also another sleep lab, IVF center, women imaging center, and state-of-art medical equipment. The fourth strategic goal was to make the hospital more visible, both in Jordan and international. So we have a lot of marketing activities, conferences, exhibitions, inviting people to visit Jordan, and we work much on the medical tourism part. Actually, now the hospital has 30 to 40% of its revenues come from foreign patients. And also we have been recognized by the MTQA, which is the Medical Travel Quality Assurance, as the first and only hospital accredited for medical tourism. And they recognize the specialty hospital as one of the top 10 in medical tourism in the worldwide. Our fifth strategic goal was the commitment to social responsibility. So we have to give back to the community, both local in Jordan and international. So we did a lot of activities to help people. So one of the things that we were proud of, that we championed a campaign to win Guinness World Record for Jordan, and we win that by achieving the largest number of organ donors in 8 hours. And this was a record registered for Jordan in 2014. Also, we have allocated a certain budget every year to treat and operate for needy and insured patients, whether Jordanians, Palestinians, Syrians, Iraqis, any patient who need surgery and who cannot afford and he has no insurance, we can provide such surgery for him free of charge. And also we did a lot of healthcare awareness campaigns like breast cancer campaign, diabetes, hypertension, breastfeeding, etc. And also at the same time, we had to help our neighboring countries. For instance, in 2011, when a revolution in Libya erupted, the healthcare system was destroyed. So they called us for help. So we had to send a team during revolution, 13 physicians and nurses to do surgeries in Benghazi. And that was the first medical team to arrive in Benghazi during the revolution worldwide. And the hospital was recognized for that. So we won the CSR Arabia Award, and also the specialty hospital was recognized by the Arab Hospital Federation as the best hospital in the Arab world in healthcare awareness. Our sixth and last strategic goal was to improve the financial status. As you know, if you want to be able to achieve your goals and to maintain your success, you must have and maintain a good cash flow and good return on investment. And thanks God, we were very successful in that as well. And in 2012, Arabia 500 awarded the hospital for being one of the top 500 companies in the financial growth rate in the region. So, in brief, that we managed to give quality, to attract talented staff, and at the same time to keep the hospital viable while expanding and increasing our services. Now the hospital is about 265 beds with more than 1,000 staff, and we have the trust of more than 750 specialists who refer their patients to our hospital. And since the opening of the hospital until now, I want to give you some figures which can tell you the trust that we achieved, that 5.5 million patients receive services in our hospital, more than 500,000 patient admissions, more than 1.35 million ER visits, more than 280,000 operations from 100 nationalities. So the hospital became an international organization. And at the same time, we had to think about how to change the hospital from a private, regular hospital into a teaching institution.
Now, Dr. Fawzi, allow me to interrupt you here.
Yeah.
You're moving into a very important topic, but you have mentioned a lot of rich information that deserves further queries. You stated those 6 strategic objectives, and you accomplished those 6. From what you have shared with us so far, there's a great case history that should be documented, published, reported. For a small hospital that I knew very well in 1994 and 2000 to where it is now, in an up-and-coming country, others around the globe would be interested in learning from the accomplishments that you have made. And how did you reach to those? For you to find out ISO 9000, I believe, and the other accreditations that you have gotten, that did not come by a chance. You dug deep to find the jewel amongst a lot of entities around the globe. So comment to me, how did, without repeating everything else, but what was the motivating point that made you create such a strategy and diligently pursuing and accomplishing?
Well, I believe that the secret comes in our dedicated staff. And if I want to tell you how many certificates that we have to renew every 2 or 3 years. We have 25 quality and accreditation and excellence certificates and awards. For instance, JCI, you have to renew it every year. The HCAC, you have to renew it every 2 years. The ISO certificates, we had about 9 or 10 of those you have to review every year. So the staff, they always on their tiptoes. They are always ready for external eye to come and evaluate their performance. So the quality became part of their culture. It became part of their daily work. And I believe that their commitment and loyalty that helped us to succeed, and the commitment and trust that we built with the consultants and specialists who refer their patients to our hospital, and by listening to them and taking their advice and their opinion, I think that was a cornerstone in our success. I think that any hospital or organization or company, if they want to succeed, they must build the proper team and they must make them feel the ownership and involvement in that hospital or that company.
Thank you, Dr. Fawzi. And I want you now to kindly move into another success story that you have, and that is taking a hospital from being an important care delivery to a teaching hospital. And I want to know how many subspecialties you have. And as I ask you to do so, we have a guest who have joined us, Professor Hani Shenaib. And as you speak, I will ask Hani to comment about your accomplishment on this section. Hani is, in his own right, he is a highly respected educator, trainer, and a professor. So I look forward for Hani to make some comments after you share with us. Please proceed, Dr. Fawzi.
Also, I want to welcome Hani, and it was a long time I didn't see, so I'm glad that he joined us. Well, I mean, it was a challenge. In 2005, we started thinking that we must do something to help our new graduate doctors. I don't know if you know that we are having many medical student graduates in Jordan. Currently, more than 10,000 medical students are studying medicine in Jordanian universities. And more than that are studying medicine abroad, outside Jordan. So, with the limited vacancies for residency programs and for specialization and subspecialization, and having this big hospital with a quite good number of faculty members who can give what they learned and their experience and their knowledge to these fresh graduates. So we thought we want to become a teaching hospital. I must say that there was resistance because it's not easy. It needs commitment and it needs resources. So we had a meeting and a meeting and a meeting with our faculty members and our board as well, because they have to provide the financial support for this project. Finally, we came into terms with the board of directors and with our colleagues. And we started in 2006 with one specialty, which it happens to be in obstetrics and gynecology. And we expanded, and now we have 11 specialties, which is recognized by the Jordanian Medical Council, the Arab Medical Council, and even the Royal Colleges of Obstetrics and Gynecology, Royal College of Surgery. So our trainees, when they finish their residency program, they can easily submit to become a member and do the exam in the Royal Colleges. So we had also affiliations. We had an affiliation with Royal Free Hospital of London. We had affiliation with Minnesota Group of Hospitals. And now we just started dialogue with Harvard to start an affiliation program to help also our trainees to have fellowship for some time of their training. I can give you an example that this year, usually the calendar year starts in the 1st of July. And every year we accept about 25 candidates. The number of applicants who applied for these 25 slots were 1,380 doctors. So you can imagine how much there is demand for training in our program and how much we have doctors looking for residency programs. We have strict criteria to choose our residents. We look at their high school grade, university grade, which university they graduate from, their internship. We do written exam, we do oral exam, and so many factors that we choose the proper residence to serve in our hospital, because he will be in our hospital for 4 or 5 years. During these years, he will be serving our patients, and we will be serving him by teaching and educating him to become a good specialist. We already trained and graduated 320 residents, mainly Jordanians, but also we gave opportunity for Palestinians, Iraqis, Syrians, and Yemenis who came in to have residency program in our hospitals. And a very good evidence of our training program success that their success rate is more than 90% in board exams, both in a Jordanian board and in the Arab board, taking into consideration that the success rate in these boards does not exceed 50% in total. So having more than 90% success rate for our residents can tell you how much we put effort in teaching and educating and training them to be successful specialists. At the same time also, we established the Specialty Training Center. The Specialty Training Center we established in 2014, and now it's a recognized training center by the American Heart Association. So we give the training certificates recognized by the AHA for BLS, ACLS, and PALS. Also, it is recognized by the American College of Surgeons to provide certificates for ATLS, which is Advanced Trauma Life Support, and ATCLS, which is for Trauma Support for Nurses. Also, our Specialty Hospital Knee Center has been approved teaching center by the International Society of Arthroscopy and Neurosurgery, which is the ISACOS. At the same time, we provide training for nurses, dietitians, medical engineers, pharmacists, and if I want to tell you the numbers of people who trained in our hospital, we have more than 2,500 clinical training, more than 1,100 clinical skills courses, and 3,500 certified healthcare providers from AHA and ACS.
Right.
So we believe that the Specialty Training Center makes a big difference in providing training for healthcare professionals, not only for doctors.
Wonderful. Dr. Fawzi, I want to seize the opportunity of having Professor Shanaib with us, being
Yes,
someone who is an educator and has been a leader well recognized around the globe, to comment about your achievements and critique it and advise us. Dr. Shanaib, we cannot hear you. We cannot hear you. Now we can.
Thank you for having me, Omar. And Dr. Fawzi, it's always a pleasure to see you again, even though remotely. I think you are really an example in a region that lacks the ability to teach at a broader level than just a local community hospital. You've really evolved it into truly an academic center. And I think that's one of the reasons why you have maintained a special status. You know, health tourism in the region, many centers have tried to maintain their presence as a site for health tourism. And I know for a fact that you receive patients from all over the Arab world. Your reputation today as a referral center is well recognized, whether you're in Algiers, Tunisia, Libya, Saudi Arabia, Yemen, the Gulf states, Iraq, and so on. So you do attract a significant number of patients from different specialties. And I suspect that one of the reasons that you've actually maintained that pioneer and sustainable status is your ability not only to provide the services, but also identify yourself as a teaching, as an educational program. So the two together have actually led you to become a true leader and maintain this leadership in there. I'm going to ask you a question because I know that you have had some challenges, particularly as they say, the bread and butter of any project is the sustainability of funding. And you are a private institution. And I wanted to know a little bit more about the financial challenges that you may have experienced in the past, contracting different governments, referrals, and how you have succeeded in maintaining the excellency that you have, renovating your equipment, renovating your human resources, and so on. I'd like to hear a little bit more about that because it's not an easy thing in that region.
Thank you, Hani. Thank you very much, and I really appreciate your comments. And yes, Jordan and my hospital is one of those hospitals who has been very successful in attracting medical tourism. And as I mentioned before, that 30 to 40% of our revenues come from foreign patients. And regarding the challenges and the financial challenges, I must say that to be able to succeed, you must distribute your pool of patients. You shouldn't focus on one country or on one segment of patients. For instance, I know that some hospitals who has focused on one country only, they suffered because some of the governments in the Arab world, they did not pay their debts in the proper time. So these hospitals went into a really big problem in finding cash flow to support themselves and to pay their debts for the companies and to pay salaries for their employees. And unfortunately, we had few hospitals in Jordan that had suffered from this. And the other thing that you have to know how to deal and to contract with insurance companies. Insurance companies everywhere in the world, they bargain, they try to delay their payments, and they try to get as much as possible of discounts while trying to get the best services available. So you have to be very cautious when you make contracts with such insurance companies. And the other thing that if you want to expand, you must expand wisely. You shouldn't burden yourself with bank loans. This again, one of the issues that some hospitals has went into, and they failed because they could not serve and they could not pay the loans interest, which became a big challenge for the hospital management to survive because of that big expansion and at the same time big loans which has been taken from banks.
Dr. Fawzi, as you have spoken about postgraduate medical and surgical education, I'm reminded with a conversation I had yesterday with one of my young colleagues, Noah Newman, who is a colleague also of Matt Levy. Noah has done a great job in hosting a number of seminars on the impact of COVID on medical education. And that has opened a whole series of conversation. And
Yeah.
now, sometimes toward the end of the year, we want to host a global virtual summit on education, and particularly tele-education. The time has come where we must seize the opportunity of going beyond borders to teach one another and learn from one another. And your institution, being a leader in teaching, and as you have shared, you have over 1,000 applicants for 25 positions. Obviously, the demand is huge. So I want to leave that thought with you, and then we'll circle back to it sometime in the near future for a summit we will hold probably in November or thereabouts. Thank you. Please proceed with your thoughts, Dr. Fawzi, about. I may suggest that you talk to us about the Private Hospital Association.
Yeah. Well, I mean, the Private Hospital Association was established in 1984, and it started with a few number of hospitals. And I was elected in 2004 to be the president of the PHA. So again, we thought what we should do. So we put our strategic goals. Our strategic goal for the Private Hospital Association was to enhance the quality and safety of hospital services provided to patients. Also, to improve the financial efficiency of member hospitals and to improve the services provided by the association for the members, and to contribute in the preparation and regulation and policies to be more fair and more adequate to the needs of the Private Hospital Association members, and to increase the number of hospitals and medical centers' capability to become competitive globally, and to improve the role of PHA and its members in serving the community. The PHA now is the sole representative of the private hospitals in local and international organizations. So we are represented in Arab Hospital Federation, International Hospital Federation, the High Health Council of Jordan, the Jordanian Medical Council, Jordanian Nursing Council, the Royal Healthcare Awareness Society, the Royal Jordanian Ambulance Center, the Healthcare Accreditation Council, and during the crisis, we represent the sector in the National Epidemiology Committee to control and manage COVID-19. And this committee was the core committee in fighting COVID-19. And also to recover from COVID-19, His Majesty, he ordered to establish a council, which is called the Economic Policy Advisory Council, to see how the economy of Jordan will recover from the effects of COVID-19. And we also advocate for the sector by meeting with His Majesty, with the Prime Minister and the related ministers to discuss the laws and regulations like malpractice liability law, which was established or published recently, and the solar energy for hospitals to cut the cost on hospitals. Also, we discuss with them the taxes and fees that is embedded on the hospitals. Also, we discuss the nationalities, the restricted nationalities who want to come to Jordan for medical tourism. And at the same time, we try to involve the Jordanian Tourism Board to come with us in marketing Jordan as a medical tourism destination. And doing all that, the PHA achieved the Best Practice Certificate twice by the King Abdullah II Award for Excellence. And also we had the Seal of Excellence from the King Abdullah Award for Excellence as well. Also, the IMTG award for Jordan as the best medical tourism destination in 2014 was depending on a file submitted by PHA to the IMTG. And also, PHA was awarded as a distinguished healthcare sector in supporting medical tourism in the Arab region. So we have been elected to be the president of the Global Healthcare Travel Council, the GHTC, which represent 40 countries which work in medical tourism, from USA to China. So they elected us to be the president of that council, and we organized a big event in Jordan, the Global Healthcare Travel Forum, in which we had 700 delegates from 50 countries. And in that forum, we announced Amman Declaration. Amman Declaration aimed to expand the scope of healthcare travel into 8 segments. So it's not only medical tourism. Medical tourism is one of 8. We added dental tourism, which is expanding now, industry, spa tourism, wellness, culinary, sport tourism, assisted residential tourism, and accessible tourism. So now we are marketing Jordan for the 8 segments of Amman Declaration, and by that we can increase the number of people coming to Jordan for healthcare travel, which is much more wider than medical tourism. And of course, the Private Hostel Association do a lot of marketing activities to promote Jordan as a medical tourism destination, whether on social media, Facebook, Instagram, and you name it. Also, we publish every year a medical tourism guide to talk about Jordan, and we speak in every single conference all over the place in the world, talking about the success story of Jordan as a medical tourism destination. By this,
Yeah, Dr. Fawzi, we have several questions that are coming
yeah,
from the audience, and
yes,
I'm going to start with one that I'm editorialized. I presume the hospitals in Jordan, each hospital has its own residency program, and they do not allow residents to go from one hospital to another. I assume that. I don't know if that's true. So the residents of specialty hospital don't go to Abdali or to Jordan.
yeah,
As you know, I've spent 50 years of my life in Atlanta and at Emory University.
yeah,
And I witnessed the transformation of postgraduate medical education in the state of Georgia, where competing hospitals would put their competition aside when it comes to resident education. For example, Emory Healthcare and Piedmont Healthcare, they're very strong competitors. Yet, we send our residents to go to Piedmont Hospital, and they go and they train there, and they're welcomed, and they have an outstanding experience. Is that something that you have on the agenda for the future, where you put your business competition aside and you unify your commitment to resident education?
Residency programs in Jordan are in the Ministry of Health, in the Royal Medical Services, in university hospitals, and now in 7 or 8 private hospitals. In the Jordanian Medical Council, we took a decision of rotating residents. So every resident, he must spend 1 year in another hospital, wherever. I mean, you can choose. He can go to like a hospital in Ministry of Health, or in the university, or in the Royal Medical Services. And this decision did not start to be implemented because it's just a few months ago, and with the COVID-19 issue. And I agree totally with you that rotating residents will give them more exposure and more benefit for the residents to learn more by exposing themselves to more and more consultants and faculty members. But this is one of the things that we are working in Jordan.
I have a comment from Dr. Naif Dibbs, who recognizes the great achievement that you have made so far, and asks you, what's next?
What's next? Actually, we have a big project, and we will build 2 towers a land slot which we buy in front of the hospital, and that will be mainly centers of excellence. So there will be like a center of excellence in neuroscience, center of excellence for women health, and like that. So again, there will be another tower which will include like hotel and apartments for foreign patients who come in and would like to be nearby the hospital for their patients. So this will be a new project which we are considering, and we are now in the phase of planning, and architects are working on that. So this would be our major step forward.
Where does telehealth, telemedicine, and teleeducation come in your strategic objectives? You know very well that that is a topic near and dear to my heart, and I would love to learn more from you if that's something you wish to pursue.
Actually, having affiliation with international hospitals and universities, part of that affiliation is teleeducation and telehealth as well. So we transmit lectures, symposiums, and our students can attend activities in those hospitals and universities. And at the same time, also we broadcast some of our activities that we do. So everybody from Jordan or abroad, he can attend. We broadcast some new surgeries that is done in our hospital. So teleeducation and telehealth is something that we believe in, and particularly during COVID-19 and having unable to make physical meetings and conferences, we did many activities during the last 3 months or 4 months for education online.
Do you wish to have what we would call grand rounds, for example, that would be broadcasted from New York or London or Mexico City to Amman, and from there to elsewhere?
Yeah. Well, I think this would be a nice idea, and we will be looking forward for your support in that, Omar. I know that you are very much keen in teleeducation, and we will be always happy to have you in and help us in doing that, which I'm sure that would help doctors not only in Jordan but also in the Arab world.
You know, I'm the chairman of the National Arab American Medical Association Foundation,
Yeah, yeah,
which you were very kind to attend our conference 2 years ago in Amman.
yeah.
And a key part of my commitment to the chairmanship of that organization is to support education. So I want to invite you to give some thought that we could jointly do lectures between my organization and your excellent hospital and network of hospitals.
Sure, we'll do that.
Great, wonderful. Well, we have covered a lot of topics, and we're very grateful for you to have shared great insight and educated us, and more so prompted us not to accept the status quo and to take a small institution into a landmark regional and international, but we look for more. Before we close, would you share with us insight about the coronavirus and how has that impacted your hospital, if any, and how did the health system in Jordan manage what they have done?
Actually, I believe that we in Jordan succeeded to contain the COVID-19. And Jordan has been one of the few countries in the world to be able to control this virus. And as I mentioned, I am already part of National Epidemiology Committee. So before we have any single case of corona in Jordan, before March, actually the first case was in the 2nd of March in 2020. We started to take actions even with 0 cases. And we decided that we will take a harsh, strong stand to fight this virus. On the 17th of March, at that time we had like few cases, like 3 or 4 cases of corona in Jordan. Jordan decided to suspend all flights from all over the world. That was very early, a very harsh decision. At the same time, the Jordanians who has been allowed to come into Jordan, they must be quarantined for 2 weeks in hotels run and supervised by the Ministry of Health and the Royal Medical Services. Total 14 days. And after that, 2 weeks quarantine in their homes under supervision as well. And every single case of COVID-19 which proved to be positive, even if asymptomatic, has been admitted to hospital, unlike many other countries. And at the same time, the Ministry of Health allocated 3 public hospitals to be designated for COVID-19 patients. So no other patients can go to any other hospital. So only these 3 hospitals has been allowed to admit patients with COVID-19. And that was a very wise decision because it prevented COVID-19 from transmitting from a COVID-19 patient to a non-COVID-19 patient. So we now, until today, we have 1,214 cases only. 700 of them are from abroad, so they are imported cases. So the total local cases is about 540 cases, and with a number of deaths only 11. Most of them, if not all, has other comorbidities. And we have been doing quite good number of testing by COVID-19 PCR. Until today, we have tested about 600,000 tests. I mean, comparing the number of population of Jordan, which is 10 million population, this is much more than the WHO recommendation that you must test 30,000 per million. We already tested 60,000 per million population. Because we managed to do that, we have been able and encouraged to open for medical tourism. So starting from the 5th of July, we launched an electronic portal called Salantak, in which Arab patients can submit their documents, their medical reports, and they can come into Jordan under strict rules, though we can provide them with a service, we can allow them into Jordan, but they must show a negative PCR test before coming and repeating the PCR test on arrival. And if both are negative, we proceed with the treatment. And when they finish, they can go home to their country, or if not, they must move from the hospital into one of the hotels designated for quarantine until they finish the period which is designed and approved by the Ministry of Health. And that was a great decision to allow medical tourism during COVID-19 pandemic. So again, this is one of the achievements that Jordan did and succeed to do in this crisis.
Fantastic. This is wonderful. Dr. Fawzi, this has been truly an exciting webinar that I have learned a lot from listening to you, although I consider myself a close friend of yours and stay in touch with you, but I have learned a lot more today. Before I close the live transmission, I want to ask you to stay online, and you and I and Matt will have a private session. So at this point in time, I want to thank Dr. Fawzi Al-Hammouri for taking the time to be with us today and share with us the rich history of the specialty hospital under his leadership and the excellent services that he has provided, not only for his hospital, but for the entire region and certainly for international health. And I want to thank Matt Levy, who has helped me before 5 years ago transmit a lecture, a neurosurgery lecture to a specialty hospital, and for being available today in support of this lecture. And until we meet again, thanks for all the audience who have listened in and the questions they have sent. Thank you all.
Thank you, Omar.